Myself Nikita Gore, and my today's topic will be the cholelithiasis. So what is cholelithiasis? Cholelithiasis is also known as gallstone, and commonly in Marathi language it is known as pittaशयाचे खडे. Okay, so we'll see what is cholelithiasis. So gallstones are known as cholelithiasis. So cholelithiasis is a clinical condition where there is a formation of gallstone in gallbladder. Gallbladder is a distended sac-like structure having a function of storage of bile. Okay, so we'll see what are the incidence rate of gallstone. Okay, so gallstone is more common among the females. Okay, female is to male ratio will be the 4:1. Means it is more common in fair, fatty, flabby ladies of 40 years of ladies. Okay, so we'll see what is the composition of gallstone first. So gallstone composed of cholesterol, bile pigment, and sometimes calcium will be present, or in some stone calcium will be absent. Okay, so then we'll see what are the etiologic factors, causative agents of formation of gallstone. So first will be the infection. Infective factors are more common. Mixed stones are infective in origin. Okay, so next will be the stasis of bile. Third factor will be the increased cholesterol level in blood. These are the etiologic factors which are responsible for the formation of the gallstone. Then next we will see what are the types of gallstone. So there are mainly two types of gallstone. First will be the metabolic stone, which are present in 20% of people, and mixed stones which are infective in origin remain 80%. Okay, so in metabolic stone also there are two subtypes, like cholesterol gallstone, and next one is a bile pigment gallstone. Okay, or pigment gallstone we'll call it as. Okay, so cholesterol gallstone are accumulated in the Hartmann's pouch of gallbladder. Okay, gallbladder is also known as Hartmann's pouch, so it will be located in the gallbladder Hartmann's pouch. Okay, so it is soft to touch. Okay, light or white in color. Then it is larger in size. Then we'll see, and it is present in about 8%. Okay, cholesterol stones are 8% from these 20% of metabolic stone. Next type will be the pigment gallstone. Pigment gallstone remain 12%. Okay, so in pigment gallstone, that is accumulated in the bile duct or in the gallbladder where it meets. Okay, so they are present in 12%. They are small in size, then they are hard putty to touch. Okay, so we'll see what are the mixed stones, which are the combination of bile pigment stone and cholesterol stone that makes mixed stone. Okay, so mixed stones are infective in origin. There it will be the infectious. We have seen the previous, that is cholesterol and pigment stone, that metabolic stones are not infective in origin. Mixed stones are present in 80% amount. It is preceded by the gallbladder infection. It is more common among the females, and this is most common type of gallstone. Okay, so we'll see what are the clinical features. Okay, symptoms of the gallstone formation. How will you understand gallstone is happening? So first clinical feature will be the pain. So pain is the most important feature, because there is a pain in right hypochondriac region. Don't be confused with the pain of the appendicitis and the pain of the gallstone. Okay, cholelithiasis pain is in right hypochondriac region, whereas in appendicitis there will be pain in right iliac fossa. Means there will be pain in right iliac fossa, and here the pain is in right hypochondriac region. Okay, so it may be radiates towards your inferior angle of your right scapula, then between the two shoulder blades. Okay, so right hypochondriac region is the main site for the pain in the gallbladder, and it will radiate to the inferior angle of right scapula between your shoulder blade here. Okay, so this will be the first clinical feature. The next, like acute cholecystitis infection, means there will be inflammation of gallbladder. So there features like mucocele and empyema, means mucus formation and plug formation. Then next feature like a loss of appetite. There will be a loss of appetite. Okay, you don't want to eat anything because there will be a loss of appetite, that is known as anorexia. Then clay colored stool, then hardening of your skin. Then next feature like acidity, heartburn, then biliary dyspepsia, means indigestion like feeling. Okay, so then features like means sometimes your gallstone will tries to come out of the gallbladder in the cystic duct, which is a narrow duct attached to the gallbladder, okay, for their pouring their secretion. So there will be a formation of biliary colic, means there will be pain, okay, pain of gallbladder will be filled, that is known as biliary colic. Sometimes there will be seen the features of obstructive jaundice also, and in this gallbladder stone or gallstone, there will be a positive Murphy's sign will be there, because Murphy's sign will be positive, means when we palpate the gallbladder, there is a pain in right hypochondriac region. When physician or doctor palpate your gallbladder and ask to take a deep breath, okay, then there will be pain and gallbladder will be palpable. In that condition, we will call it as a Murphy's sign is positive. I am not saying it is a Murphy's triad. Appendicitis, Murphy's triad is different. That is pain, vomiting, temperature increase will be there, and this is a Murphy's sign is positive. This is a nature breath attempt. Okay, when gallbladder becomes palpable when you take a deep breath. Okay, so Murphy's sign will be positive in cholelithiasis patients. Then we will see what are the diagnostic tests or investigations for the cholelithiasis. First will be the straight X-ray. 90% of gallstones are translucent, but mixed stone is radio opaque. So translucent stones having no calcium, they will not be visible in straight X-ray. As cholesterol and pigment that have no calcium content, so it will not cast any shadow on the straight X-ray. Okay, mixed stone can be when it have a calcium. So straight X-ray. After this we will do ultrasonography. It is a very most common test, that is ultrasonography. All know that USG that will show gallstone as well as bile duct stone also. Then we will see cholangiography, cholecystography, oral cholecystography. Okay, so these are the diagnostic or investigations for the cholelithiasis condition. Then preventive treatment will be in allopathy like cholecystectomy. But by diet and management, how will you control? So if a patient is suffering from this type of cholelithiasis, gallstone, pain in right hypochondriac region, that medication is important, but your diet management should be there. So I have shown on my screen that cucumber juice, spinach, leafy vegetables should be included in your diet. Drink plenty of water. Then cucumber juice, okay, spinach, this should be included in your diet, rich in vitamin C and all. Okay, so you should take this. So come to the point, homeopathic management. So homeopathic management, first remedy like Chilidonium majus. It is the miracle in the diseases of the gallstone as well as liver symptoms. Okay, liver related diseases also cured by the Chilidonium majus, and Chilidonium majus is a very excellent remedy in the diseases of the gallstone and liver diseases also. So here for the gallstone, there will be a pain in right hypochondriac region. The patient tell us that there is a pain here, so we'll understand there is a pain in right hypochondriac region, and that will patient will tell that is radiating towards the inferior angle of your right side of the scapula. So in that condition, we will give the Chilidonium majus. Next medicine like we will see Lycopodium. Lycopodium is also a good medicine. There will be in patient, there will be a canine hunger, means few mouthful gas fills up to the throat. There will be no more eating, there will be no sufficient eating, but there will be a heaviness in abdomen. Okay, so in Lycopodium patient, there is a brain fat. The patient will be have a fear. Patient will take that he have or she have the fear of appearing in public, dread appearance. Okay, so patient will have a shooting type of pain in right hypochondriac region that will radiate to his back or between the shoulder blade. In that condition, we will give the Lycopodium. Next medicine like we will see Nux vomica. The gallstone have resulted due to the high standard of living, due to elements from rich fatty food, having no physical activity, more physical activity, and alcoholism and all, means high standard of living. In that patient we will give Nux vomica. Then Berberis vulgaris is also an excellent remedy in kidney symptoms also, kidney diseases also, but in gallstone it will be the effective remedy. So there will be a pain, bruise type of pain, okay, bruising type of pain in right hypochondriac region. In that condition we will give Berberis vulgaris. Next medicine like phosphorus means the gallstone has resulted due to bad habits like alcoholism. In that condition we will give phosphorus. Then kalkiriaka for the fair, fatty, flabby ladies, means obese, overweight ladies, and in that condition there will be a right hypochondriac region pain. In that condition we will give kalkiriaka. So pain is different type. Okay, pain in right hypochondriac region but radiating to your the inferior angle of right scapula. In that condition we have give chilidonium majus. In lycopodium patient there is a pain in right hypochondriac region but radiating towards the back, and there is a pain like shooting type of pain, so we will have given the lycopodium. So pain is the most clinical important feature for identification of the cholelithiasis patient. There will be a Murphy's sign positive gallbladder. Normally gallbladder is not palpable, but in the patients of cholelithiasis of gallstone there will be a gallbladder will be the palpable. So you should take the homeopathic treatment on it. Homeopathy definitely cures you. Okay, there is an individual remedy for the individual patient, as I always say. So you should take the homeopathy treatment for the permanent cure. If you like this video, please like, share and subscribe my channel. Thank you.